Anyway, thank you. We all want to be outside rather than here. It's absolutely a beautiful day. I'll get you out of here as quick as possible after the pulmonology lecture. So we'll move right along here. This lecture really is for you guys, you ladies. It's not about me. I'm here to educate you. I'm not a podiatrist, a foot and ankle specialist. I am an educator. Okay, I got my teaching degree. I got my athletic training degree. I've been around the world with U.S. Soccer and other companies I work for, or actually a company that I work for, sneaker-wise. So I've been around, seen a lot, 26 years of practice, 206,000 patients I've seen in 26 years, a little bit more than that actually. So I've seen some pathology, some different feet, a lot of feet. And people ask me why do I want to be a foot doctor. I look at it as better than being a dentist or OBGYN. So anyway, but really it came down to that, when I was in school, I had a lot of injuries myself. So a lot of things that you people have, I've had or have, whether it's a simple ingrown toenail to a arch problem to a fifth metatarsal fracture. And we'll chat about, anatomy and a little bit of things here. So it's not, this lecture is not about me. It's about you interacting. I'm going to expect you to be part of this. I'm not going to give a lecture and show slides. I can do that. I already just did it for the last 4 hours for a bunch of physical therapists that many of you have already been to because I've sent you there for a number of reasons. So anyway, so you're here for one reason. You all have something in common, but you're all different. All right? Some people are affected differently. It could be more pulmonology issues, could be more foot and ankle issues, orthopedic issues. Could be more cardiovascular, but it's as you all know, it's a multi-system disease. It affects everybody a little differently in the degree, diversity of it, and so on. So you have to look at it from a team approach. And I do a lot of teams, a lot of players from all over the country, not just Philly sports and international people. But the bottom line, it's not just about sports. It's about, again, a team approach where I'm just one part of your whole body. So you have your infectious disease, you'll have your cardiology, you'll have your dermatologist, okay? Just like we do with diabetics and some of the things I see a lot of medical issues that are associated with the foot. So as a result of that, we have to think that the foot is connected to the rest of the body. Again, it's a team approach. It's comprehensive care, okay? We have to see what the diagnosis is. It's not a symptom. It's not just pain. Okay, or swelling. We're looking at the cause. I treat causes. I don't treat symptoms, or at least I attempt to treat causes and find out what's caused. I consider myself like going to Pep Boys and get a diagnostic check on my car, checking underneath the hood. All right, and finding out a diagnosis and not treating a symptom. We do it a little different at HealthMark in that sense. So I'm not just going to give you a pill. I want to find out why, and then look at it if it's the primary problem or it's something secondary to something else. So that's how I work, and hopefully you'll get that from me. So again, multi-system disease, and I want to hear as many questions or whatever that you may have. I want to try to touch base with all of you. So I want to start with a couple things first. So if somebody raised their hand and want to start with something to do with foot or ankle. So who do we have? Who's going to raise their hand first? Yep.
High heels.
Okay, so, because this is about interacting, and everybody's going to learn. There's no one bad question, stupid question, or whatever. High heels. So let's think about this. High heels. My personal views about high heels, let's talk about shoes first. Because mostly maybe it's more female-oriented here than male. All right. However, as ladies get older, or even when you're younger, but mostly as you get older, and when you have disease like scleroderma, diabetes, age, as you get older, you lose fat. Fat, if I'm looking in the mirror now than you did before, fat is gone some places you don't want it to be, but there's also some places you really need it to be, and you need it on your feet. Because feet, right now you can check your piggies. I can make, in some of my lectures, I actually have people stand up and check their piggies. Okay, and see what their feet actually look like. If they can get to them because they have a bad knee or whatever, to look on the bottom. Or the spouse they came with can actually look at their feet. So you lose fat. And we'll get to the heel thing, but You lose fat. And we call it fat pad atrophy, fat pad shift. That means the fat on your heel and the fat on the ball of your foot gets thinner. From scleroderma, diabetes, I can name a bunch. It gets thinner in the heel and thinner in the ball of the foot. So you should have 12 to 28 millimeters of fat in your heel, and you should have about 6 to 12 in the ball of your foot, at the base of your toes and where your metatarsal heads are. Okay? And as a result, so you're talking here, 12 to 28, and here, 6 to 10 millimeters. Now that shifts, that moves, and it also gets shorter. So it gets thinner and shifts. So as a result, you feel sometimes you're walking on a stone. You're walking on a pebble. You're walking on skin and bone. It burns, it aches, it barks. All right? As a result, okay, a lot of times it's just simply fat pad thinning or fat pad shift. So now it's more in your arch, and now it's more out towards the base of the toes. And as a result, that's where we talk about shoes, all right, and high heels. If you don't learn anything today, you can wear anything you want, but not too much of one thing. So, all these ladies' fads, now everybody's into the boots. Before that, it was the Dansko clogs. Before that, it was the chunky style shoes. Before that, actually in between that, we had Sperry topsider moccasins, okay? Then we had chunky style shoes. All right, we've had it all. But the problem is everybody jumps on the bandwagon on one shoe. And they come to the office and we love it. Because they're wearing one shoe, one type of shoe. So if you don't learn anything today, you can wear high heels, you can wear flats, but don't live in one type. So you can wear anything. Now, it doesn't go by the height of the heel. This is a very common thing. Everybody says, oh, I can't wear high heels. I have scleroderma, or I'm too old, or whatever it may be. But you can. The question is, it doesn't go by how high the heel is. It goes by where it bends, where it flexes. Any shoe, where it bends. So you can have a 4-inch shoe, 4-inch high heel shoe from Payless, and you can have a 2-inch heel from Nordstrom. I'm not picking on either company, okay? And the one from the one of the Payless is 4 inches high, feels great because where it bends. And you wore that to the wedding all day, and you danced up the storm, and you ate and drank, and it was merry and happy. So it doesn't go by heel height; it goes by where it bends. We call it shoe bite, where that shoe bends, where it kinks. It should be just behind the ball of the foot, behind the base of the toes. You'll know. It'll feel good on the store. That salesman saying, "Buy it, buy it, buy it," because they're getting, credit. You take them home for 3 to 5 days. Doesn't feel right staying around the house, keeping them clean. Get store credit, bring them back. It's called shoe bite, but they may feel good on the store, but after you wear them for a while, they're just not working. So it doesn't go by heel height. It goes by where that shoe bends. Next is if you like a company, don't switch. If you like Bandolino, you like Nike, you like New Balance, you like Fry boots, I don't care what it is. I'm not partial to that. But the bottom line is you like a company, you stay with that company unless they make some radical change. The old KISS method, keep it simple, stupid. Okay? The simple things. The old things sometimes work rather than new drugs and the new things. Go back to basics. Okay? The KISS method. But if you like a company, don't switch. Why? When a shoe is made for male or females or whatever, it's made based on a thing called a shoe last, L-A-S-T. Maybe back in the day when you went to see a shoemaker, we have some good shoemakers still around that's still off the boat. Okay, and they still make shoes, repair shoes, and it's coming back because it's so expensive now. People will repair shoes more now than buy them, okay, if they're repairable. And there's some good shoe people around. But the whole idea is the shoe or a sneaker, I'm talking about shoes in general, is based on a shoe last, L-A-S-T. It's either made out of wood or metal, okay, and they actually like cutting a foot off here, a leg off here, and they make a mold. So they make a negative mold, and then they fill that with either wood, plaster, metal, and then they make a mold. That's like having somebody get amputated and you got a mold. That mold is $100,000 to $250,000. You know no shoe company is going to want to get rid of that real quick or quickly because that's big bucks. So they will use it to possible. But that's made on so-and-so's foot. So everybody's foot's not the same. 7 or 8 years ago, you used to have all the shoes are really just made on a men's foot type. And then women got the nod, and they can now make shoes based on a women's foot type. Never. That's one foot. There's a lot of different piggies in the world. So that's why if you like a company and they don't switch their mold, then you're good to go almost every time if you like a company. So keep that in mind. It's based on this. All right? So it's a shoe mold. So if that works, stay with it. Next thing is never wear anything old. I'd rather see cheap new from Kohl's and Payless than old and expensive from, again, Nordstrom's. Why? It's all about shock absorption. I'm trying to save your joints. I'm trying to keep you walking. I have to keep you walking so you can breathe better for that pulmonologist from Boston, now in Philadelphia. Okay? I got to keep you moving. That's my goal. I got to keep you moving. I'm going to get you, hon. Okay, old? As old as you want to feel. Okay, I'll tell you. Yeah, I'll tell you. Okay, I'm going to go to those features. So I have to keep you moving. That's my goal. Why? Keeps your sugar down. Keeps your VO2 max up in your breathing. Okay? Keeps your arteries going in your legs. All right? Keeps your hair on your head. Okay? The bottom line is I got to keep you moving. All right? So, rotate shoes. You should never wear the same type or pair all day. Change it up. Many of you are my patients. They know I grill that. Okay? You get into trouble if you wear the same type. The nurses all now wear Dansko clogs because they're made in Chester County. 2 million they made last year in Chester County, and there's an outlet down there, and they love it. But I love it because those nurses come right across the hallway, 100 feet away from the operating room in Phoenixville Hospital, and they walk in, and they're like, oh, I just did four 10-hour shifts. Yeah, and they wore the same Danskos or the same shoes. I'm not picking on Dansko, okay, all day for 10 to 12 hours. No, you know your feet feel better when you put a different pair of shoes and socks on. You know that. Mentally and physically, it feels better. But it's doing a lot for your joints. I'm not talking just your piggies, your back, and your knee. Really, from the bra strap down. Right. So change your shoes, rotate them. Don't use the same style. Go out to dinner, put a pair of slip-ons on. Wore all day, you wore sneakers around the house or whatever. You run to the Acme, put something else on. Really, really important for your joints, especially if a lot of you people have fat pad shift and that thinning. Right? Your shoes are your fat. Shoes make you function. So in regard to old, we don't know what old is, but in a lot of sneakers, I'll actually pick up the left shoe, and inside, I'll actually tell people, and you've heard this thing in the office, actually put the date with a black Sharpie magic marker on the inside. And then you know how long those shoes are, or how old they are. Or you put it on your phone, or if you go to the store, they have you in the computer and all that. They're emailing the heck out of you and all that kind of stuff, all right? But there's going to have notate it somewhere on your calendar, the old-fashioned calendar in the kitchen on it, all right? But have it in there. So when you're looking at a shoe, to say for a sneaker, for instance, okay, it may look good on top. It may look on the bottom, okay? But really, that's not the problem. It's the midsole. It's the stuff in between. That's what dies. That's what bottoms out. That gets smushy. That's what dries out. So you'll say, I don't need a new pair of sneakers. I only wear them in the summer. I wear them every summer. But what happens from summer to summer, the guts of this thing dries out, and you lose shock absorption. So it may look good, but on the bottom and top, but it's dead. Okay, it's bottomed out. It doesn't have the same flexibility. It doesn't have the shock absorption. It doesn't have the same mechanics of a shoe or sneaker. So again, notate it. Ideally, if you have many shoes, you rotate them. They're all going to last longer. So I'll ask you to initially put out some money, get a couple of different pairs of shoes, 2 or 3 pairs, and then rotate them. It's going to help a lot of things, not just longevity of the shoe, but it's also going to help you not create issues with the same type of shoe. So you have, not to pick on South Philly, you have a lot of Italians down there that they've been down there since they were little kids. They were born there. They still live there. They're now in their 70s and 80s. And they wore high heels forever. And you ask them now at 60 or 70 years old, I want you to go down because they have Achilles tendon problems or butt problems or hamstring problems high up or just foot problems in the ball of the foot because they lost fat. And they'll say, I can't. I've worn a high heel all. And let me tell you, they've been contracted so short because they stayed in the heel that whole time because they wore one type of shoe. You ask to put them in a sneaker or a sandal or something smaller, they can't do it because they've contracted so tight. And you're telling a 70-year-old lady, like I would say from Brooklyn or South Philly, okay, and it's like, they just can't do that. So we have to send them to physical therapy to get some motion in there. But they wore the same type. It's not good because it creates bone and, I call it meat, but soft tissue problems. Tendons, ligaments, and other soft tissue. Give me 1 second. So the point is you can wear heels. You can wear flip-flops. You hear a podiatrist telling about flip-flops? Really? That's like Iverson saying practice? Right. Okay? Really? Okay? So the bottom line is you can wear anything you want as long as it's in good condition and don't wear the heck out of it. Okay? So you can wear high heels and watch the flex point. Watch the company, use them to go out to dinner, use them for the, you go to a wedding, you bring 2 pairs of shoes. You got a long day to New York City for a girls' event, you're going to see a play, 2 pairs of shoes. It's better. You'll feel better physically, mentally, but it's doing better for you. Okay? So, again, it doesn't go by heel height, it goes by where it bends. So there's some shoes out now. In the last year, they're starting to fade. The fat is fading. Okay? They were 4 to 6 inches. And they're up. They're 4 to 6. Now, I'm not exaggerating. But they don't bend. The people have no pain in the ball of the foot. They don't bend. They're not bending, but they're 6 inches high. And they walk around all the time, and they're comfortable. And I can name the company with them, and they're comfortable. They're just fine. So it doesn't go by heel height.
What company is that?
Kohan.
What is it?
Kohan. Yeah, but there's a lot of companies besides that. Candies has them, the old-fashioned Candies come. You'll see them in Lord & Taylor. You'll see them in Nordstrom's. You'll see them in Macy's, and some other more boutique stores that are more expensive. But the bottom line is this. In regard to heels, she brought up a very good point. The point is this. Also, it goes by the thickness. So it's the heel height, where it bends, and I want a differential. Why those high-heeled ones from those companies I mentioned is they have a higher heel and they have a differential. So it's not going to really thin. It's not really going to thick. We don't want a platform. If we're going to use a platform, we don't want it. That's what's the matter with some of the clogs. They're too even. What's the matter with the moccasins? They're too flat. These are too high but flat. They're too even. They're too platform-like. So we always are looking for a differential. So most sneakers have a differential. Most high heels have a differential. So what makes that 6-inch one is, literally it's 4 to 6 inches here, but it's also 1.5 inches here. Yeah. And that makes all the blinking difference in the world. So look for differential besides that. Okay, so those are some of the features about shoe gear in general.
Inserts. When you go to a podiatrist and you've gotten inserts because you have a high instep, low instep, whatever. Okay, so you have to keep changing that from shoe to shoe. Mm-hmm. But if you are working and you're on your feet for 8 hours, right, you have the insert in that shoe. Mm-hmm. So you should get another shoe and put that insert in that shoe and put it on for another X amount of hours, even though it's the same type of sneaker.
Yep. Okay. So good point. So what do we do? You get an insert from a podiatrist of any type, or you just get an insert from one of the companies that are out there. Spenco, Dr. Scholl's. There's one company you have to know, Superfeet. There's tons of them out there. All right. The bottom line is, I have a thing in my world is that I don't think you should wear the same inserts all the time. I think you need to rotate them. So if you don't want to wear them all the time, I don't think you should wear them all the time. So the question comes down to how much you're doing, what surface you're on, what problem you have the inserts for. But I'm telling you, I don't like to have people just stay in orthotics or arch supports or inserts, whatever you want to call them, footbeds. All right, the bottom line is you don't have to live in them all the time, and you shouldn't, because I don't want you to become too accustomed to them. Yet again, I don't want to create new problems. So I want something in between. That's just my philosophy, and it's worked for 26 years for the most part. Now, I've had inserts since May 6, 1980, when I ripped a piece of meat off the side of my knee. Okay, and I've had 5 pairs. Now, I wear my cowboy boots, I wear my flip-flops, go barefoot. I don't wear them all the time, but I wear them a large portion. When I think I need them. If I'm going to be walking in Philly, I'm going to be on my feet at a game. I'm traveling. I'll go for my runs. But I'll take them out for a while, wear my cowboy boots. The key thing is mix it up. Don't become too dependent on one type of shoe or one type of insert. Now, a lot of shoes, Ortho Heel, Naote, Birkenstock, you've all seen them out there. A lot of them have removable inserts that are pretty doggone good, that are footbed, okay, that work really well, and you now can get replacements, so the shoe can still be good, not old, like the lady in the back said, what old is, and you can just replace the footbed and make the shoe last even longer, and you just be as comfortable. Or you can take that footbed out of that shoe, and put it in your sneaker, if it works. So you don't need to get an orthotic from a podiatrist, an orthotic, prosthetic person, a physical therapist. So you make it work that way. But there's some times that I don't want you to wear that. I want you to mix it up. I want to spread the forces, spread the flex point where your foot's going. So I would like to mix it up. But there's other options other than a custom orthotic from a podiatrist. Yes, I use them, I think, when I have to use them, when we have no other alternatives, or I'm trying to treat a primary problem, but we try some other options too based on your needs. Why do you, they're not the magic shovels that become ice scrapers. Okay? I want them to be functional. I have to keep you functional. I want to make you that. And they're all not the same. So you should, when you go to a foot doctor or any of those other specialties, orthopedists, whatever, that insert should not be the same. That's made for everybody should be the same. So if you took some off here in the room, they better not be looking the same or from the same doctor. They should all be individual and truly custom. You want to make sure they are custom. You're paying money for them and a lot of money for those. So you can try things over the counter. If it doesn't work, then you work your way up. But they all should be different based on your needs. No fat. You have a bunion. The toe is pointing towards King of Prussia and the other toe is pointing towards Springfield. Okay? All those things. And as a result, we do it for different reasons. I had it for my knee. Sometimes we use it for back problems. Okay? The foot is connected to the rest of the body. The first signs of a lot of diseases start in the foot. Syphilis, AIDS, believe it or not, hypothyroidism, some scleroderma, gout, diabetes, rheumatoid arthritis in the heel. It starts in the heel, rheumatoid arthritis. A lot of body things, what we call systemic things, start in the foot. Okay? Breathing issues. You see a lot of nail issues, fingers and toenails, because of breathing issues. We'll see that. Which then, all right, you got a breathing issue? All right, maybe scleroderma. Maybe something else, COPD. You've all heard those words before on TV with commercials and that. Or you have it yourself and you know it. So the bottom line is the foot is really, a lot of times, we have dermatology, we have circulation issues with vascular, we have orthopedic problems, we have structural problems with bones, okay? We have nail issues, we have different disciplines. We have infectious disease. We have all those things that are in there. We have nerve problems coming from the back, coming from just the foot. Like carpal tunnel, we have tarsal tunnel that starts on the inside of the ankle. So the foot encompasses the entire body of different disciplines. That makes it a little different. So that's why when someone says to me when I'm going to see a big-time athlete, and they said, oh, here's the orthopedic surgeon and here's the podiatrist. Well, we have a problem in podiatry with public relations because I did a 3-year residency, I did a foot and ankle fellowship, I did amputations, but I did breast implants. I did infectious disease, but I did anesthesia. Okay? A lot of the podiatrists coming out are doing that, but there's that time there where there's a lot of people who didn't do that. And they're just doing corns and calluses, or they're just doing surgery, or they're just doing sports medicine. But you got to get somebody who's well-rounded and know your doctor, whether it's another doctor or a podiatrist. So I'm a foot and ankle specialist. I'm not a foot and ankle orthopedist. We do surgery just as much as they do, but they were trained only mostly to do surgery, but they don't do the other systemic things. They don't do a lot of scleroderma stuff. They won't do a lot of nail stuff. They won't do anything else but usually cut and run, and I don't mean that negatively, but they're not looking at the entire patient. They're not looking at the function of the patient. They want to see, oh, the surgery's healed? Later. Okay? I want to see you function after my surgery or after my treatment that you're doing better than when you came in. Or at least there, if not better. It's about keeping you functioning. That's the difference between a foot and ankle specialist, a podiatrist, and a foot and ankle orthopedist or an orthopedist. And again, I'm not knocking orthopedists. They're some of my best buddies. But it's all based on training. So most foot and ankle orthopedists will only get 6 months to 1 year of training. Okay, we get 1 to 4 years after our residency, our residency, fellowship, internship. They get 6 months to 1 year of a super specialty or a fellowship. They've had their 4 years of undergraduate, they've had their 4 years of school, of medical school, just like we did, and that's when the training changes. We're doing the whole body. Like I say, I did anesthesia, I did OB, 18 months, all that. But it all changes. Then you go to the foot and ankle, but it encompasses everything. Yes?
One of the big problems I have with the scleroderma is I live in Uggs in the wintertime because of the fact that my feet need to stay warm because of the Reynolds. It affects my feet also. I did find a pair of Uggs with the big heels and the same ratio you were talking about, the platform that I can wear, with business attire
Sure.
for my business. But besides that, I live in them and I've got an arch, so I know that's not the best thing for my feet, but I've got to keep my feet warm. And I keep a heater. Every one of my offices has a heater under my desk
Right.
and a fan because I know that if you're cold, if you heat your feet, it'll
Everything goes
warm
good.
your body,
Right.
and same with the coolness. So I live in sandals and open
Right.
heels all summer, and then in the winter I
Yeah,
have
Uggs.
to keep that. That's the only thing I found that works.
Okay, so let's look at this, dissect this out a little bit. So first of all, she heard the word Raynaud's phenomena. Who's got it? Oh boy, we got to stand here. Okay, so what is it? I'm here to educate you. So what is it? Somebody say it. What is it? What is it? Yeah, what's Raynaud's phenomena? What is it?
Restriction of blood vessels.
Okay, restriction of blood vessels. It's a blood problem, a circulation problem. What else? What does it do? What's the effects of it? Cold, right? Okay. Tingling sensation. Those are all symptoms. But what? Okay, so let me educate you what it is in my simple world. So Raynaud's phenomena, okay, or Raynaud's phenomena, however you want to say it, East Coast, West Coast, whatever. Okay. The bottom line is, you have arteries, right? Take blood away. You have veins that bring blood back to your heart. Okay? So this is an artery problem. It's blood going down south to those piggies, to those hands. Okay? This is your core. This is your chest. This is your core. The goal of the whole human body is to keep this warm. If you don't keep this warm, blood gets pulled from where? Everywhere it gets cold. Here, 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 everywhere. Fingers, extremities. To keep this warm. That's what we're trying to do. You're keeping your core temperature up and warm and stable. So what happens when Raynaud's phenomena, there's two types, if you want to keep it simple. There's primary and secondary. Primary is it just happens, mostly in women. It just happens. Where? It just happens. There's no underlying disease. Secondary, it's secondary to something else. Scleroderma, kidney disease, cancer, chemotherapy, we can go on and on, the cause of it. There's primary and secondary, but the results are the same. You're trying to keep the core temperature warm. So the blood gets shunted and pulled back to keep it here. With Uggs, you're trying to keep it warm. But really, we don't want to treat the symptom, which is her piggies and her fingers with Uggs. We want to treat the cause. It's all about cause. So I want to keep this warm. So what do? I make sure you layer 2 or 3 things. You have a cami on, you have an undershirt on that's tight, you have different layers, and you have a sleeveless jacket on in the house. Okay, you watch the vents, you watch the environmental aspect of it, but you need to layer to keep this warm. Okay, every once in a while, what do you need to do? Hot tea, just plain old hot water. Keep this core temperature warm. Sit on a heating pad. Okay, just eat some food. What does food do? What does water do? It actually creates what we call heat. Keeps this warm. So I would say to her, not just the Uggs, we got to treat not just the cold piggies and make sure there's no fan blowing. I want her to get up every 15 to 20 minutes and do this on her laptop, talk on the phone, walk around. I want to get that blood going, in and out. It just gets down, okay? And then what happens is with Raynaud's phenomenon, the actual vessels, arteries that carry blood away, actually go into spasm. So you all know, white, black, or indifferent, you all know the color changes that you see in your piggies and hands. It's pretty scary sometimes. It's that blue, white, maroon. We call it mottling, M-O-T-T-L-I-N-G, all right? And it gets that way. And what happens is they go into spasm. So the first phase, you'll see they just get cold. They get a little white. Then the second phase, you see they get a little darker. You see a little blue and red. And the next phase, you see really deep blue, really deep maroon, and it starts to hurt and starts to concern you. Okay, and you get more tense, and it gets worse. Okay, and the last phase you see is when it really gets bad, and you start to see death to the bone, death to the tips of the toes and the fingers, where it's so cold and frozen and so shut down that what happens is you start to cause death to the tips of the fingers and toes. It's almost like frostbite. I'll be 1 second. Like frostbite and frost nip. Chilblains, you've all heard, trench foot, all that stuff depends if there's water involved or air or whatever. So that's the kind of phases of it. So all of a sudden then it just gets better. And you see, look at your hands and feet, it's like, oh my God, they're bright red, they're maroon, they're pink, like you see with some of the ladies' tops here. And what happens is those gates that were into spasm shut down, they became white, shut down a long time, they became blue and red, okay, and maroonish and that nasty looking look, and then all of a sudden you see bright red. And what it is those gates have now opened up, and that blood is that pipeline is opened up. They opened up that big wheel, and the pipeline opened up, and the blood's flowing again. The oil's flowing again, because the cycle was broken. That vasospasm went away. Just like we see with breathing issues. You go into, right, bronchospasm and all that. You get your breathing, they're going into spasm, whether it's exercise-induced, cold weather, or whatever, or medically. So same thing, you go into spasm. So I don't want spasm. I don't want those to shut down. So I'm going to say, don't sit in that chair, move. I want you to move for many reasons. One of them is for circulation reasons. The blood getting in and out and stop that spasm. I want to not lose heat. I want to layer. I want to keep that energy production up. I want to eat. I want to drink things. I want to keep that temperature up. It's all about keeping the temperature up. Whether it's wearing a hat besides those Uggs. I also want to change those Uggs because those Uggs, I want to have 2 or 3 pairs because they get wet. It's dark, it's moist, it's warm. Then you start to sweat, a low-grade sweat, and then you need, I don't mean like sweating, like, you know, then all of a sudden they get cold and you're right back into it. So that's another reason you change your shoes 2 or 3 times a day. I don't want to create that environmental issue. You better have some different pairs of Uggs. They get too old, lose the fuzz, get rid of them. Also, I can get an extra pair of liners of fleece that can go in there from LL Beans, and all the companies have them, okay, that you can put in that boot or in that flip-flop, or that Ugg, okay, that you can get as a liner that's made out of, you know, like I say, fleece or lamb's wool. It's going to help your cushioning. It's also going to help your warmth, okay, and again, rotate them. Let those shoes air out. Don't wear them all day. Put another pair on. Okay, I have multiple pairs. So that's really, and again, too old, again, you can have the shock absorbing issue. So do that. Next thing in regard to that, in regard to Uggs, and I'm not picking on Uggs or Bare Paws, there's a couple different names out there. The socks that you actually wear. I can tell you your grandmother told you to wear 100% cotton. And grandmother's wrong. Grandmother's wrong, okay? Times have changed. My mother, right, so why? Because all this cotton do is absorb, nothing else. So now you have a Johnson & Johnson's ball of cotton on your foot. It's like having those little powder puffs on your foot and wet. And then you look at it, they turn white, they're discolored, all that stuff because it's been wet, a wet sock in the foot, and you get colder. And you got Raynaud's, and the whole process goes. So I want a blend. I want cotton and acrylic. I want cotton on one side to absorb. I want acrylic to pull the moisture away. Orlon, nylon, polypropylene wool as the other side. 60-40, 80-20, 70-30, I don't care. But I want a blend on one side and cotton on the other because the acrylics, and I'm not trying to pick on Orlon or nylon, pulls the moisture away. It wicks it away. It pulls it away and creates a layer in between the two to create an air pocket so you don't get Raynaud's. You don't get athlete's foot and break down the skin, and it can start all kinds of scleroderma complications. So I want to create that layer in there, that cloud, that environmental layer that doesn't it. So I want a blend.
Those people don't wear socks with Uggs.
Right, and they come to the office for warts. So what happens is, but in all seriousness, and that's a Conestoga thing along the way here. But the bottom line is, to actually try sometimes, you actually feel warmer with something in there because you want to create layers, just like you did here. You want layers, okay? We don't like to wear gloves. We want to wear mittens because you're creating that layer in there. We want to wear 2 pairs. We may put gloves down and put mittens on it. We want a layer, and we want something close to the skin, and we want something in between. Same thing with Uggs. I tell those people, put some socks in, your Uggs will feel better. And put the right socks on. And change them regularly, because they're going to get cold and sweaty. Change them twice a day. So I change my socks and shoes twice a day, at least, if not more. From environmental control, warts, calluses, corns, yeast infections, all that stuff, nail issues, and also from a Raynaud's phenomena point of view, from a big boy point of view, metabolic issues, systemic issues. All right, so I would tell her to wear socks and then change them often. I don't care if you're wearing the same shoe. And then don't wear those same Uggs all day. Have 3 pairs of Uggs and rotate them.
Yeah, but aren't you, and I do have a lot of Uggs.
Yeah, you're defeating the purpose, but right now, yeah.
It's still the flat.
It's still the flat, so that's what I'm saying. You can put an insole in there. You can actually put a heel lift in there. We can do some other things to actually modify that shoe, okay, to mix it. I'll actually put a little heel lift in, just every once in a while, just change it up. All right, sometimes I have the shoemaker put on the bottom a beveled, sole that blends in nicely. If you go to the right shoemaker, it doesn't look like you have a heel and sole lift on, and that way you have a little something that works. I tried on
Like the little gel ones you buy?
Yeah, but you can buy them. You can put it inside. You can actually, shoemaker puts it on the outside and just blends it in. Looks like it was not even. It looks custom. You can't see the seam. Nothing. A good shoemaker can do that. So I'll try to modify that shoe to make it work. But here she's wearing the same ones, but we can do it for many reasons. But I'm treating the cause, Raynaud's. I'm not treating a symptom of cold feet. I'm looking not to treat a symptom. Yeah, somebody back here, and I think there was somebody here also, yeah.
We're talking a lot about shoes.
Yeah,
I was a barefoot child. I'm a barefoot adult. I do not like to wear shoes.
Good.
I'm curious if I will wear them in public, obviously. I'm curious if there's any.
yeah.
Say don't be barefoot.
No, I'm not in, I think you should mix it up. I don't think you should live barefoot. I don't think you should live in high heels. I think you should mix it up. You've heard the last 2 or 3 years about the barefoot movement and everybody trying to run with barefoot or lesser sole. Well, that's now only down to 9%. It never got more than 17% of the population. So there's going to be some people who are going to be like you, I don't say the extreme, but you're a barefoot person, go for it. I mean, that's how they are in certain parts of the other countries, okay? I have many Kenyan runners that they run here, the top 6 in the world, that train in Valley Forge Park. You'll see lightning going through there with white snow, and it's like, whoa, what's this? And you see in this, as dark as can be, Kenyan running through it's like, whoa, what's that? And they can't put a piece of loose leaf paper, Xerox paper, whatever company you want to call it, underneath their foot. It's so flat, okay? And they're used to being somewhere, Mexico, Africa, wherever, and they don't like shoes, but they'll have something on for protection.
Well, I'm wondering, protection, like as far as the fat thinning out.
Right. So there's some shoes that you can get some Vibram shoes. You can get some low one, even ones like this that are, this is a little bit bulkier, but it has no seams. We like no seams for a lot of sclerodermas because they have you guys have a lot of toe and nail issues. So as a result, we want something with no seams, no extra gingerbread or every kind of extra like reinforcement things. We want a smooth toe box. Something flexible like this is a knitted shoe. Okay, this is all knit. It's a new shoe that's out, and basically it accommodates a lot of bunions, toe problems, and it's got good cushioning inside and on the outside. But you can get a low-profile shoe that's pretty doggone good, and every company has them. Brooks, New Balance, you've heard them all, okay, Nike, whoever it is, that you can wear something that's a low profile that can simulate barefoot, okay? It's called, you have a minimalist shoe, you have what they call a zero drop shoe, which is really thin 6 millimeter sole, like you see, almost smaller than an UGG, okay? But you have to put something obviously for work or weddings or whatever.
Well, that's what I'm wearing, but more the lack of tolerance is coming from the shoe itself, not the bottom.
Right.
But it's like being confined in the shoe.
Right. So again, finding the material. I have many diabetics and people who are systemically challenged, like scleroderma patients. They just can't do anything. They can't even. When I was in third year medical school, there was a neurologist was up there from UPenn, and he said, "There's going to be a time where you'll be sitting and a patient will come in, like they have to flip their socks inside out because they can't take the seams." And I went, "You freaking kidding me? No, really?" And you know what? That's true. Okay, and I have a couple pairs of socks that I get to trial out or whatever. Like, I don't like this seam when I'm running. And I actually did. I was like, wow. Okay, and I didn't believe them. Okay, and as a result, really a simple seam was the same thing with a shoe. And the material in the shoe. I'm actually happen to be working on some information now for a shoe company that actually looking on the inside of the shoe. We all talk about Gore-Tex outside of shoes and water repellent. I'm talking about environmental control in the shoe. Okay, so I'm actually looking at keeping a foot warm when it's cold. When a foot's cold, I'm making it warm. So we're looking at inside the shoe now. But again, it's material, it's texture, it's the shock absorber. It's a lot of things that you got to find the right, no seams. You got to find that right company. There's plenty of it out there. Unfortunately, it's a search and destroy until you find it. And something low enough profile. Like the Vibrant, like I was telling my last lecture, I gave 4.5 hours of lecture before this. And I had a patient that gave me these Vibram shoes, okay? And they also gave me a pair of socks a number of years ago that had individual toes to them. And you can try to use those for your Raynaud's phenomena, okay? But some people said, I got such problems with my scleroderma and nerve problems with my feet, I can't take those on my individual piggies. So I got a pair of that. It was a Monday night, quarter to 9 at night. It was nice to get me both things for Christmas. I'm like, oh, I don't feel bad. I want to use these things. I'm in the hallway after seeing patients for 11 hours that day, and I'm trying to struggle to put the dog Vibram shoes on, and I'm trying to. I get 2 toes in one spot and 1 toe in the other one. I'm like, what the hell? I need this crap at 11 hours into the day, right? Of seeing no patients all day, and I finally got in, and I just wasn't comfortable with them. But again, those Vibram soles have changed in the last 3 or 4 years. it's VIBRAM, okay, they've now changed to have more of an arch. When they first came out, there was nothing to them. And I said, well, I'm going to try them out. I said, I'm going down the shore. I'm going to run 4 miles in them. I went 4 blocks. And I was like, oh, man, I wasn't used to it. And that's my whole point is of switching it all up, not to create one problem and make another problem go away. So always mix it up. So with you, I would like to see you mix it up, look for some environment. All the shoes are morphing. They're all evolving. When they first came out, they're a lot different. When I can actually pull those on now with the new pair, a lot easier than when I first got the pair. Now I'm getting twosies in one. Okay? So some people are just that way. You just like the Kenyan runners. They don't like having anything on the foot. They don't even like having an arch. But they got to have something for protection. All right? So somebody else had a question? Anybody question? So that's a little bit about shoes and socks, but you want to blend. If everything gets too old, same thing with socks. You're going to lose that power of absorption and wicking away and shock absorption. So get rid of the socks. Question back here? No? Okay, that's good. Yeah.
Why do you say, if you're talking about the linear thing?
Right.
Why do you say flip-flops?
Okay, so you can wear anything you want, but nothing old. And if you like a company, don't switch. There's a difference. A lot of people come to the office and say, oh, I'm wearing flip-flops. And they're really not wearing flip-flops. They're wearing sandals. Okay? And especially guys. Oh, I'm wearing flip-flops. They come in with a little sandal. I mean, I'm not talking, the sandal. They have a little bit of an arch. They got a little bit of a heel. They got a little bit of a heel cup. Like it's cupped. Okay? They have those features. That's not a flip-flop. That's a sandal. And you're seeing more and more sandals now. They'll all be out in about 2 weeks. They'll all start coming out. That's a sandal. But you can still wear a flip-flop. And we're talking about the old flip-flops. Slip-on, what you call them thongs and tongs and all that other stuff we all called them back in the day. Okay? But or they have the piece on, they don't have the thing between the first and second toes. Okay? So that's a difference. But you can wear a flip-flop. But just the problem is, by the end of the summer, what's that flip-flop look like? It's bottomed out, the one side's like this, the bottom on this side's smooshed down to this, because you lived in them. All right? And you came to the office because you had heel pain. All right? So my point is, buy a good flip-flop. There's one called Havaiana. It's from Brazil. It's been around since 1966. Havaiana, you can get them all over the place now, but they've made it in this country in the last 3 years. I went to the company in Brazil 2 years ago when I was down there for a U.S. soccer game and getting ready for the Olympics coming up. So we were on the Amazon where they make them. And they're all over the world. But Havaiana is a good Brazilian rubber. Rubber started in Brazil, then it was stolen and went to the Philippines. And that's how it all changed, okay? So what happened was, it's good rubber. It doesn't bottom out. So that flip-flop in June will look like it looks in August. It's not the other one from Old Navy. Again, I'm not picking on companies, but Old Navy and some of the other ones are there. Walmart. Actually, some of the Walmart stuff is, again, it does. I'm not trying to pick. Some of the Walmart stuff is very good. Okay, some of the Kmart stuff is very good. The Texas Longhorn Brahma boots from Kmart and Walmart are really good work boots. And they're only $39 to $52. So don't go by price. Okay? Go by fit. Don't go by size. Go by fit. Everything's small. I wear an 8.5 shoe. I wear a 9.5 Nike. Something's not right there, but that's everybody. So don't go. But where a lot of you scleroderma people get in trouble is, oh, I'm now 50 years old and I want to wear my 7.5s. The sizes have changed. Not because your foot has changed. The industry has changed. So even though you may see like you got a bunion again, King of Prussia, so what? It's really the industry has changed because the smalls and mediums and larges is a lot different now. Even though you've gotten bigger or skinnier, it's much different. So don't go by size, go by fit. Oh my God, I'm wearing a size 13 now. Oh, okay, when I used to fit in a size 10. Okay, but really it's the industry. Okay, so don't go by, please don't, because that creates a lot of foot problems.
Could you talk to us a little bit about nail issues?
Yeah, good. Yeah, it's good. All right, so fingers and toes, okay, you get nail issues. As you get older, in general, nail issues become a problem. Maybe Raynaud's, maybe in general, just circulation and vascular compromise. The 3 main arteries in the foot don't work, so the circulation doesn't get there. So why do you get funny-looking nails? Thickness, discoloration, ingrown, painful, ugly-looking, okay, scaly, peely, rolling in. I mean, they do all they want. Dark, just gross. Gross is the word, whatever, okay? It can happen on fingernails too, but it doesn't happen on fingernails as much as why? Circulation. Closer to the heart. The piggy's a lot further away. That's one. Number two is you're stuffing in those Uggs all day, and you create an environmental hazard, okay? You now have a Purdue incubator, okay? Dark, moist, warm.
And
Dark, moist, warm, okay? Bugs grow. Athlete's foot, yeast, okay? Viruses, all kinds of stuff. It grows in there. So I tell the kids, okay, to actually control the environment. Helps a lot of different things, not just circulation and warmth, but, all right? So, again, when they come in the office and they got these nails, they look like grandma nails, okay, and you're only 18, and I believe me, I see it in 6-year-olds. I've seen it in 2-day-old kids, and they've never had a shoe on, and mom was clean. Never had a vaginal infection, never had a uterine infection, and their nails are looking ugly, and they have fungus, and mom is clean as can be. One partner, okay? Why does it happen? Nobody knows, but it happens. It's all over the place. These bugs, we call them bugs, okay? Athlete's foot, okay? 3 major bugs, call them tinea, okay? Tinea pedis. Basically, it can make the nails thick, thin, brown, yellow, fall off, ingrown, whatever it wants to do. The bottom line is treat the cause. Now, was it an injury? People come in because they're runners, they're doing Zumba and all this stuff, but really the nails were too long, or they're walking in Center City because they're running late on Septon and say, oh, I didn't have time to put my sneakers on, I'm going to wear my high heel shoes. The stocking is pulling up and flicking the nail like this, okay? Their foot's going like this in my 6-inch heels that I told you to wear, okay? And that nail is now pointing towards Canada, okay? Why? All right, because the nail was too long and the bugs get underneath. Why do we see it so much with our pedicurists? Why? The ladies and the men want to see their nails and their cuticles far back, so they put that little instrument in there. And, oh, that nails look good. You know, I'm going to my wedding, and look at my piggies. I got my mani penny, okay? Because they push the cuticle back, and when they push the cuticle back, here's the cuticle, right? That half moon that you see in your nails. The nail fits in like this. The nail plate fits in the cuticle like this, and you see that half moon. What happens is that pedicurist goes like this and pushes that cuticle back, breaks the seal. The bug guts in. You walk from septa, and all of a sudden that nail is flicking up. The stocking's pulling up. You're wearing those high heels. That bug gets underneath. That's the cause.
So manicures and pedicures are not.
No, they're good, but you got to make sure who you go to, what you go to, how aggressive they are. Okay? Let me get to that. I'll tell you. So what happens again? The cause, or was it just because they're not tying laces? America doesn't tie their laces. You go anywhere else in the world, everybody ties their laces except America. America's lazy when it comes to that. Oh, they come in tying them. Oh, I tied them, right? Really? Kidding me? That's my shoe. Okay? I think you need to look in the mirror. It's not that case. It's everybody. It's America. How many problems we have with foot and knee and back from not tying your laces? It's ridiculous. Because all day they're doing this. You want a heel pain? They're banging this all day. All day they got toe pain? They're gripping them to hold them on. Don't tie their laces. They're lazy. They got a bad back. They're too fat. They don't do anything. They don't have any gym class. There's no sidewalks. Okay? But they don't want to bend them over. And I'm not trying to be mean, but really, that's a big problem in America. They don't tie their laces. And as a result, they're getting a lot of motion. If you don't remember anything today, motion causes pain. Motion causes deformity. You use something the wrong way, it wears out. Use a knee the wrong way, a shoulder some way. You're compensating because you have a bad right foot, and you had a total knee done in this foot. Now you're compensating on this foot. That foot starts to have symptoms. So we look at muscle imbalance, muscle weakness, compensation. So we see a lot of that people. They come in, the shoe, and it's not that the shoe was old. They wore the same shoe. They wore the same Ugg. No, they wore Uggs the whole time. They wonder why they have toe pain. They're gripping to hold them on because they walked 4 miles in Uggs, and they had to do this to hold them on. And they get toe pain or ball of foot pain. So treat the cause. They stayed in the one shoe, and they wore something that was holding on. Or the shoe was so loose, they're actually pistoning like this. In the top of the line, $150 Asics sneaker. So we have a real big problem with tying laces. Or Velcro. A lot of people like to use Velcros, diabetes, or with scleroderma problems with their fingers and rheumatoid patients. They don't have the strength to tie lace. They don't have the dexterity. They don't have right? So Velcro works. But Velcro gets loose. So before you know it, you have rubbing, you have irritation, you have ulceration, you have toe problems because it's not, the foot should be locked in the shoe as one unit. The foot and shoe should move as one unit. Motion causes pain, motion causes deformity. I don't care if it's skin, nail, bone, bunion. Bunion is genetic, but it's also due to motion. That metatarsal is moving in, the toe is moving out. A bunion is a bone problem. It's a motion problem. It's not a bump. Bunion means bump in Greek. It means cauliflower in Greek, actually. It means bump in Latin. But really, it's the metatarsal moving in. It's a bone problem. It's not the bump. It's the whole thing's moving in. So again, the metatarsal is going towards King of Prussia, and the toe is going towards Springfield. Again, like this. It's going in and out. Okay, it's going just like that. So the metatarsus going in, toes going out. It's a bone problem. So motion causes that. Motion causes pain. Motion causes deformity. So we want good motion. And we want to lock that foot and shoe in. So again, mixing up shoes is critical because we don't want wear one thing out. And we don't want it too old. So again, things get created that way. So getting back to the nail. So you get banging the nail. So it can look like a fungus. Really, it's actually injury to the nail. Whether they did it from a shoe or the pedicures went a little too quick, a little too short, and actually nipped the nail bed. Here's the plate, here's the bed. So that's why it's the circulation and the nerve is here. It's the bed, and there's the nail. So we got to make sure, is it truly a nail issue from fungus? Did you drop something on it? It's going to grow out in how long? UPenn study, 237 days a toenail takes to grow out. 106 on the fingers, typically. Okay, so that's a good question on a Saturday night. Okay? All right? And so what happens because it's closer to your heart, okay, and you don't have other issues in shoes and that. So a lot of the issues we see in feet is related to shoes for whatever reason, okay? But again, for fungus nails, make sure truly it is a fungus. It can do anything it wants. A fungus in one person is different than a fungus in another as far as the presentation. It can only be the side of the nail, it can be the whole nail, it can be in the bed and not on the plate. It can look thicker underneath, but the plate itself looks good. It could be from an injury where you actually hurt the cuticle back here, and now as it grows out, that's tough because that's where it grows from, the bottom of the nail. And if it gets hurt there, then it's tough as that nail grows out. So you can get some ridges. Now, a lot of nail problems, again, respiratory problems, you'll see spoon nails. The nail looks like this. It's like a spoon, inverted spoon, because of breathing problems. So we got to make sure it's not just a fungus. We all say it's fungus, okay? But we got to make sure it's that. And what do you do for it? There's a lot of things you do for it. Many of you have heard me say about it, you don't need the expensive medicine, you can go cheap, okay? We can use a lot of things, but you have to be consistent. That bug, those 3 bugs grow all the time, and you got to control the environment. A lot of people, not just tying shoes, when's the last time people actually bent over and washed their feet? I don't care if you're 9 or you're 79. A lot of people don't bend over and wash their feet and get the dead stuff off. Not like Grandma said, scrub your feet, because that's not good. You don't want to scrub your feet because your skin is a barrier. And with scleroderma patients, you get that skin thin, that crest stuff comes out. We got our little paste coming out. We got issues. So you don't scrub. You wash well, but you don't scrub. Like Mom said, get everything out of there. I want to see you clean. We've all been there, okay? Whether it's 10 years ago or 50 years ago, okay? The point is wash well and dry well, and make sure you rinse well. If you don't rinse well, that soap stays on, it eats through your skin, then I got scleroderma problems. So make sure you wash well, rinse well, dry well. You don't shake off like a dog and I got to get going to work. Like most guys do. Ladies don't do that. Most guys do. But they don't tie well, they don't wash well, they don't dry well. They got bad backs. Kids are a problem. They lock that door. They got that music on their iPad, their iPod. I hate my mother. I hate my teacher. I don't want to do my homework. I never bend over. I asked that question. We did a survey in the office. 78% of the kids did not wash their feet. Now, that's not a bad thing because their feet were clean. Their feet were clean. They didn't smell. They were clean. We don't see a lot of smelly feet in our office, okay? People like to go to the dentist. They, you go to the doctor, you should change your underwear. Same thing, okay? The bottom line is we really don't see it. The point is honestly, really, they don't exfoliate. They don't get rid of the dead stuff, and that's when bugs grow. And when I use bugs, I'm talking about yeast, bacteria, all the things that are out there. So physically bend over. Now, if you can't bend over because you have scleroderma, bad back, whatever, then you get a stool, or you get something for the tub, or you get a seat, okay, something like that, so you can actually do that. Or get a chair that can bring your foot up to you, okay. But it's not a hygiene issue most of the time. It's an exfoliation issue, or a lack of washing and drying, okay. Mostly drying because what? Dark, moist, warm environment, the bugs grow again, okay. And so what happens is you got the same thing. We got to affect that environment. So I can give you all the magic medicine you want for your fungus nails, but if you don't treat the cause. So I use vinegar. You want to use something consistently. White vinegar for 59 cents from Heinz or Acme. Put it on all the nails twice a day with a Q-tip. You don't have to stuff it in there. It kills bugs. It kills fungus. It's acetic acid. I use soft scrub, the bathroom cleaner. Once a week I do a soft scrub. Go to a new medium toothbrush you buy from CVS, and I scrub all the nails. Then you rinse because it's an abrasive. It's got Clorox in it. It's got bleach in it, and it dries the nails out so the bugs don't grow. You got to create that environment. So I can give you Lamisil, that little critter used to run around TV. I can give you medicine for $30, $50, $90. But you got to do the other things. It's comprehensive care. So those are similar. Otherwise, you can use some topicals, prescription or not, but you got to be consistent, and you got to do the other things to help those nails out. And tie the laces and change the shoes and all that to create that environment. Otherwise, and you can do laser that you hear about now, but it's cash. We don't do laser. It's not been proven to work for any nails yet. It should be used for tune-up rather than a primary treatment. So again, get the cause, treat the cause, not just the symptom. Now, sometimes they get ingrown, then we have to take a piece out permanently, and it's done. So ingrowns could cause them in other ways, injury, fungus, whatever. And as a result, what happens is sometimes you permanently have to take them out. With scleroderma patients, we have to watch because we have to numb it up here, make sure they have good circulation to make it heal. So you got to make sure you're able to heal because we have problems with scleroderma patients with healing all over, but especially on piggies because the circulation sometimes is not good, whether it's Raynaud's or the circulation is not getting there. So you can numb it up and you take a piece all the way down the side. You don't feel it, you just feel pressure. And the piece of nail, you take it out and you put some chemical in the corner. And the chance of it coming back to the rest of your life, this side, not the whole nail. We rarely take a whole nail off because it takes so long to come back and it's sore. And you can't put a shoe on for weeks. So we don't do that unless we have to. You take a piece back and you soak and just the new edge comes over and it's done. But you put a little chemical back in the cuticle and that kills it. The corner, and then you're done. Your ingrowns are done.
Even if the nail's very curved?
Yeah, so you try to flatten it out, you try to get rid of the disease part of it, and then we call it pincher nails. Some nails are pinching on themselves. We call them pinchers. They actually go like this, and they actually touch, and all that stuff gets caught in there. I mean, not fungus, I'm talking the nail bed gets pinched. Yeah. It's pretty sore. So a lot of times we'll still with that, create a border, create space, and take that out. But we want to make sure the nail plate's good quality. Right. But literally, it's some of them that's like, wow, that should be hurting like crazy. It literally pinches. We call it pincher nail. Yeah, cuts tight, and the nail bed gets caught in there. There's somebody here.
I missed the soft scrub. Can you use the soft scrub?
Yeah, soft scrub the bathroom cleaner. Get the green label. It comes in 4 different flavors. And literally, you want the one that says with bleach, with green. Okay, it's a green label. And get soft scrub. Don't get Acme. Okay, I'm not trying to be.
And you do
Once a week, you do it. You take a new medium toothbrush and you go up in sides, across the bottom, across the top. You know, and just do up the sides. You don't have to scrub like heck, but just get all the nails, even though all of them don't have it. Just go up and down, across the top, go to the next nail. And then rinse. Make sure you rinse, because that's very drying. You don't want to over dry it. And only once a week. We call it Sunday night scrub.
You were saying,
Feet,
you
yeah.
were saying vinegar?
Yeah, vinegar, white vinegar.
What is that
It's-
opposed
see-
to alcohol? My
Alcohol is too drying. Too drying. It's going to affect your skin more than that. And way too drying. You know from dermatology, put in your face, way too drying.
So white vinegar.
White vinegar, not wine vinegar, white vinegar. Okay, we get that too. But really, so those are all the little things you can do, but you got to be consistent. You got to do the other things to kill that bug. So when Lamisil was around, the one you used to see years ago, the little critter, but you got to just not take the oral meds. You got to do the other things too to get the 92% rate. I lectured all over the world for Lamisil. And because you have to do the other things. Throw the old shoes out. You got to, every once in a while, put those shoes out on a nice day like today and let them air out. Let those bugs dry out. Those bugs are heat insensitive, or heat sensitive and cold sensitive. Kill them, because you're putting your foot into the incubator. So let them air out, okay? Don't put them in the closet. What's the closet? It's another incubator, dark, moist, warm. Let your spouse trip over them, okay? Because you don't want to put them in the closet, all right? And so as a result, yes, so there's 2 things you can put in a shoe. You can get sneaker balls that have, you can put sneaker balls in there that have a deodorizer in it. You can Febreze them. You can really sneakers, even these sneakers, eventually they'll go in the wash machine. Just let them dry out. Stuff them with paper towel or Bounty, whatever you want, newspaper, and they'll dry out. Okay, you're fine with washing them. Next thing is there's things actually have ultrasound. You actually have a shoe tree for $110. You can actually get an ultrasound shoe tree that kills the bugs. It makes them go crazy. It just blows their brains out. Okay? All right? And so what happens is that's another way with ultrasound. So there's things you can put in. There's deodorized shoe trees now that actually kill the bugs. So there's other options besides that. You got to treat the shoe too. Sometimes you just got to throw the doggone things out.
Okay.
Questions? I haven't gotten to anything I wanted to talk about. I mean, I really have not gotten anything I want to talk about.
Split toenails.
All right, so the other thing too is this, as crazy as this may sound, okay, you know you have split skin. We haven't even talked about, we just talked about derm today. But split skin in your heels, whatever your guy's going to get it because your skin is real thin. So you can get the $96 prescription, but we just use super glue and crazy glue, okay? And that stuff works good. So you take a Q-tip, buy like a toothpick instead, and just stroke it on that split. Okay, it's like some people like to use clear nail polish, but just use a slit of it. I mean, a little bit on the slit, and that stops the skin from doing this. But what caused it? Those Uggs, those barefoot around the house, because when you step down, your fat splays. So you don't cup it all day, that fat, or you don't give it shock absorber here, that you're actually, the skin splits. So to not cause other problems, the guys get it because they wear loafers and their heels doing this all day or rubbing this way, and the guys will get it. So that fat doesn't get cupped. And when it doesn't cup, it splays out. The fat splays out and skin splits. The skin splits.
My thumbs, though.
And the thumbs,
I glue them all the
right,
time.
and just because of circulation issues, it's because you're bumping them. You maybe have them too much in the dishpan. Maybe you dry them out too much. Maybe you're using the wrong lotion. I mean, there's a lot of issues that can cause split skin. We just pick people's brains until we figure it out. But there's a lot of topicals you can put on there that have urea in it. Amlactin's 12 to 13%. Alluvia is 39%. We got other different types of urea that are an exfoliant and a moisturizer. A lot of times a moisturizer will not work. You need both. You need both. And you think, oh, all the other companies are out there for moisturizer, but it's not working. So you try. You got to just try to see what works for your skin. We know in Afro-Americans, there ain't nothing like Grandma taught us. Vaseline, baby. There's nothing like Vaseline and shea butter. Shea butter and Vaseline. It works on a lot of things, but it doesn't work in white people. Okay? Not as much. Okay? It doesn't. It just doesn't. Okay? As well. It could, and I'm not trying to pick on people. I'm not that way. But I'm telling you, Vaseline, why? It occludes it, actually blocks the skin from sweating, and the water can't get out, so it blocks it. There's different mechanisms of how creams and ointments and that work. So it happens to work in skin that has a lot of melanin and it's dark. It works great. I mean, it's smooth and shiny. It's gorgeous skin. Okay, it works again in Mediterranean Italians and some of the Jewish people around the Mediterranean. Okay, so you got to see what works. There's plenty out there. Whatever works for you may not work for Mary Smith or John Doe. I haven't talked about anything I want to talk about. But anyway.
On the feet, you don't put the lotion between the toes, definitely.
I try not, but if I do, I don't use it all the time, and I rub it in well. People think, oh, I just put it on, and it doesn't work. You got to rub it in for 60 to 90 seconds. Work it in. Otherwise, it doesn't work. Anything. You got to rub it in. The other thing, too, there should be a lag time. By the time you get out of the shower, shake off and dry and all that stuff, and you put it on. So a lot of people they put it on at the wrong time. They don't give it enough time to work. So they come out of the shower, they don't dry, okay, or they put it on, then they put the shoe back on. So as a result, it stays moist all day. So give some time between the shower and the sock and the shoe. There's got to be some lag time, okay? Because when you put that on, it doesn't work as well or it causes new problems. You got to rub stuff in. You got to give it a time to dry, time for you to dry, time for it to dry before you get going. Really, really critical. And that's for nails or skin, anywhere. It's really, really, really big, yeah.
You mentioned the word urea.
Yeah.
I have used products with that, and it really worked. Would you ad lib on urea?
Yeah, urea is it's in everything. It's in a lot of, you just see with urea, you'll see it in a lot of preparations from 10% to 50%. If you put 50% on a nail every day, the nail is going in 30 days. That's how strong it is. So over-the-counter stuff is 10 to 12%. The prescription stuff is 20 to 39% and up. But urea is an exfoliant. It eats through the dead stuff. And then you have a moisturizer behind that. And a lot of times it's dual products in one. But it's a very good product. But what may work for you may not work for the next person.
Do you know the name of a couple of those products?
That have it?
Oh, well, like I say, you can talk with
Combination.
Amlactin is one over-the-counter. Amlactin. Amlactin. That's an over-the-counter one. It was a prescription like 10 years ago. You have one with like CeraVe and CREVE. You have Gormel, Gormel, Gormel. There's a lot of stuff with urea in it. There's so many different names. Dermazorb is another one. There's so many that are out there that have urea in it of a certain percentage from 10 and work your way up. But I don't care how much it is and what you do with it. You got to rub it in and you got to give it a little time to work before you put your shoes and socks on. Otherwise, it's absorbed through the shoes and all that. So give it a time to work in, but you got to work in. And really, you do it or let your neighbor or friend or spouse do it. So was it a question? Yeah.
Can you talk about what the Scleroderma patient should do for the fat pad atrophy?
Yeah, so we do a lot of things. This is what I never got to. So we do a couple things. So there's a lot of materials out there that you can use. This is we use for scleroderma. We use this for diabetics. We use it for rheumatoid. We use it for people who just don't have fat. And we can either make it a bilaminate, meaning 2 layers, One is for shock absorption, that's the peach stuff on top, and one on the bottom, which is called PPT, that's for shear, because you guys are getting, and girls are getting a lot of shear and shock absorbing issues. So a lot of times we want to make it a bilaminate, two things. So we'll actually put something like this in the shoe. Yes, we'll use some gel, some gel products that we use. You'll see some up here. We'll actually use some gel products that actually have gel inside, and we use this for hockey players, but this is an elbow pad, but this actually has vitamin E and vitamin A in it that soaks through your skin from Swiss grade. It's a gel, okay, you can see. But basically, it's for shock absorption and that, okay, but it also moisturizes and also gives you shock. That happens to be a heel pad, but we use it, elbow pad, we use it for heels. But it's moisturizes because it's got vitamin E and vitamin A, but it's also got shock absorbing qualities more than anything. It's over the counter. It's coming to Philadelphia and most of the drugstores soon. But it's been around for years. It's just a high grade gel. All the gels are different. That's a very good company. But you get some gels that are just out there, like some of the Dr. Scholl stuff is not very good because it's just a low grade gel. It's called Gel Smart. It's online. Gel Smart. Gel Smart. GELSMART. One word, Gel Smart. The company that dispenses is called Pedifix, PEDIFIX, Pedifix. They have very good quality products. So again, we use a variety of materials. We can use this blue material on top. We can use this crepe that's the same thing that's inside of sneakers. It all depends on where you need to unload, load, stop with that. And again, you can get it in shoes too. When you look at it in shoes, you look for that certain shoes that have more shock and more midsole. Remember, we're looking for not the bottom, not the top. We're looking for the guts in between in your shoes. It will give you more fat, essentially. Well, there's no one good sneaker, okay? And I'm not going to say my company, anybody else's company, but there's a lot of good companies and what works for you. So it could be New Balance, it could be Brooks. I'm a big Brooks fan. I like a sneaker called Brooks, okay, for a lot of my scleroderma patients, okay? But again, it all depends on what you like. I would get a running sneaker, though. I don't really believe in walking sneakers. I get a running sneaker because it's different. It's got more shock absorption. It's got more heel, a higher heel. It's got a smoother toe box. It's got a removable insole so you can put something in there. So I prefer a running shoe to walk, to get around. When we know there's enough in here around that have running shoes on, okay, that is a running shoe instead of a walking shoe. There's a couple good walking shoes, but walking shoes are out. We're done with them for the most part. That was a fad 5 to 10 years ago. It's over. Okay, and there's some good ones that actually are some true walking shoes that actually can act like a running shoe. And Brooks has some of those. Okay, but there's New Balance. All the companies have a walking shoe that can act like a running shoe, but I would say get a running shoe instead. That's just my own thoughts because of all the features it has. And again, there's a lot of good companies. And again, what works for you may not work for you because you may need more toe box problem. You may have to want it higher here, okay, versus you need much more here, or it's too flat and the arch doesn't match up right. So you got to make sure the arch matches up. So it may work in a New Balance, but not in a Brooks. It may work in a Nike, not in an Asics. Yeah.
Sometimes it feels like my feet change sizes. Like I'll have a bad day.
Right.
Feel really
So the question is it because they're splaying out? Because that's what happens. Ladies will flatten and splay, so my foot got bigger. It certainly got bigger after pregnancy and all those hormone changes. It'll never be the same. Average female gains 9.9 pounds. Shoe size goes up 1, never comes back. Okay, all that hormone stuff changed it. So you're going to go flatter and wider as you get older. And some days it may just be circulation because of Raynaud's or circulation, whatever. You hung them down all day because you were at a play or at a movie. So when you're underneath that desk, move them. Get that circulation going. But sometimes we'll feel, or sometimes you've aggravated that joint because you wore the same shoes all day and it got fatter. So we want to find out why it became fatter. Is it a circulation problem? Is it a structural problem? Is it just, it's not getting in and out? There's a lot of reasons why. You stood all day at a concert, okay?
Well, it often happens on a motorcycle.
Well, yeah, you're hanging them down all day. Your knees are bent. Your knees are bent, right, like this. The blood's coming up. Okay, why do people with pregnancy get bad vein and artery problems? Why? They got a big belly now. The blood comes up, hits up here at north, goes back down south. Okay, so it doesn't get the nutrition, and as a result, swells. You get your varicose veins, big old tortuous one like my wife had here. Okay, and it's because of the damn kids. You guys sacrificed your life for us. Okay, so all right, but it happens. But treat the cause. It's a big belly, all right, or you can be American and have a big belly, or you can be the skinniest person and be a secretary, and you sit all day. And what happens? The blood still comes up there. They sit there all day because the boss says, "Don't leave that damn seat." Okay, and they're sitting there all day and they're never moving their legs in a meeting. okay, and it comes up here, and they're skinny, they're 106 pounds. But then the blood comes here, doesn't get the nutrition, goes back down, whoop. So move, move, move. Your body's made to move. It's a machine. I know the next speaker's got to go. Yeah. I can go forever, so we can do it some other time if you want. So I didn't talk about my, sorry. So.